The spectrum of disease slide should be included anytime you are using this tool. This slide is a conversation starter, and by asking thoughtful questions will help you learn more about your customer. This is a clinically focused slide, and the key message is that there is a treatment gap for men with intermediate risk disease, and until recently, they haven't had a great treatment option. The talk track and probing questions for this slide are meant to get the customer to agree to a treatment gap for men. Prostate cancer is a variable disease. Managing it requires multiple clinical inputs. As you discuss the different risk profiles, ask the customer how segment their patients into the different categories and their preferred treatment protocol for each. As you go through the spectrum of the disease, mention all the advancements that have happened in diagnosis and determine the disease's risk level, like imaging, genomic testing. Use this as an opportunity to ask about how they use imaging in their targeted biopsy program. This slide lends itself to deep discussion and is one of the best opportunities to learn about the surgeon. Questions to consider: do you have a targeted biopsy program? Why did you adopt it, and how has it changed your treatment algorithm? How do you treat Gleason 6, Gleason 7, 3+4, or low volume, 4+3? What is your criteria for moving a man from active surveillance to treatment? What clinical inputs do you use to make that decision? How do you approach salvage therapy after failed radical procedure? Excitement around HIFU therapy for prostate cancer. Use this slide as an opportunity to sell clinically. This slide, more than most, gives you a number of pathways to engage the customer, assuming you have thoroughly prepared for the meeting and have a firm grasp on the surgeon's priorities. By understanding your customer's priorities or pain points, you can tailor the talk track to the customer's hot-button issues. Make the delivery of this slide personal and create a sense of urgency. This slide validates that focal therapy is an effective oncologic procedure, while preserving sexual and urinary function. Subtly explain that if you aren't doing focal therapy now, you're already behind. Start by explaining that the evidence shows that, for the appropriate patient population, focal therapy ablates 80 to 90% of targeted, clinically significant cancer, while reducing functional side effects. Remind the customer often that this isn't a new therapy, and evidence shows focal therapy is reproducible and effective procedure. This slide does have a red flag: watch out. The slide highlights that a propensity score matched study found equivalent oncologic outcomes at 8 years between radical prostatectomy and HIFU. Before highlighting this data point, research propensity score matched studies, learn how they are designed. Also, you'll need to establish equal clinical stature before focusing on this data point. Some probing questions to ask on this slide includes: what criteria and inputs do you use to move a patient from active surveillance? How have patients' priorities/expectations evolved over time? How do you counsel a diagnosed patient as Gleason 7, 3+4, with low volume disease, 1 or 2 positive cores? How do you treat patients with clinically significant disease but can't tolerate surgery? How does your institution handle salvage therapy? A slide displaying the results of a single-center, prospective study aiming to evaluate the short-term oncologic results. Included in the key message, highlight the fact that the evidence shown is level 1 and proves focal 1 HIFU results in superior continence and erectile function with excellent short-term oncologic control. This study should address any concerns the customer has regarding short-term oncologic results of HIFU. The talk track has a single central message: level 1 evidence proves focal 1 HIFU has superior continence and erectile function with excellent short-term oncologic effects. Use the data points in the study to confirm the statement. Some probing questions to use during this slide might be: how do you handle mid-grade, localized renal disease? Why do you do partial nephrectomies when possible? Define a successful treatment outcome at 1 year post-op for a surgery patient, for radiation, for focal therapy. How do you track your patients post-operatively? How have expectations for functional outcomes changed in the last 10 years? The ongoing randomized, controlled study out of Norway is showing strong outcomes when comparing radical prostatectomy to HIFU. The key message for this slide is that focal 1 HIFU is an effective oncologic procedure for men with intermediate risk disease. When discussing this slide, emphasize that the results are early and from AAU poster. Start your talk track by setting up the study. The aim is to compare the oncologic results for radical prostatectomy and HIFU for intermediate risk patients. The early results show focal 1 HIFU had fewer treatment failures and improved functional outcomes. Emphasize that we are actively partnering with institutions and surgeons to determine the clinical efficacy of HIFU for intermediate risk prostate cancer. When asking probing questions for this slide, use these examples to start the conversation. When was the last time you saw an RCT comparing surgical modalities? What would you expect the oncologic results to show comparing RLAP to HIFU and MUIR for intermediate risk prostate cancer? Regardless of therapy, define a success for a patient at 1 year post-op.
The role of focal therapy with discontinuation of AS slide can be leveraged to create a real sense of urgency if they haven't started considering a HIFU program yet.
The key message for the slide is, your peers overwhelmingly agree that there is a role for focal therapy in men discontinuing active surveillance. The talk track for this slide is very important and needs to be thoroughly practiced before using it with a customer. Start by explaining that a consensus statement published in Urologic Oncology in 2021.
A multidisciplinary group of urologists, radiologists and radiation oncologists to give their opinion on the place for HIFU in the treatment of prostate cancer. Point or highlight that 87% of your peers recognize the role of focal therapy for men who discontinue active surveillance.
Your peers are telling the society leadership and industry that focal therapy is versatile. Institutions are using focal therapy to reintroduce patients who have experienced disease progression back into active surveillance. Some probing questions to asking the customer on this slide. 1. How do you currently treat men progressing out of active surveillance? 2. In your mind, where does focal therapy fit in a patient's treatment pathway and what do you see as the future of focal therapy? Societies are notoriously slow to validate new technology or therapy and update guidelines and physician stations. For example, it wasn't until 2015 that the New England Journal of Medicine declared that a laparoscopic gallbladder is now the standard of care. So, when societies do plant their flag in the ground regarding a therapy, technique, or technology, surgeons pay attentioning. The key message for this slide is professional societies are now including HIFU in guidelines.
AWA/ASTRO removed experimental designation and included focal ablation in as an option for select intermediate risk patients.
A secondary core message for this slide is a focal 1 HIFU procedure is reproducible, patients are seeking it, is reimbursed well, and now societies are including HIFU in their guidelines. Mention, when appropriate, often. We provide a reproducible therapy that customers are asking for, that has an attractive economic story and by the way, is clinical effective in treating prostate cancer, with superior functional outcomes. AWA and ASTRO often produce joint statements regarding the clinical validity of therapies, technologies, or approach.
Indiana 20217 THACE Group classified HIFU as experimental.
But in 2022, a joint panel of expert urologists and radiologists released a statement identifying HIFU as an effective treatment for intermediate stage prostate cancer.
Probing questions to ask while using this slide: what screening and treatment guidelines do you most closely follow?
Why is there so much excitement and noise surrounding HIFU in the last year? What's driving it? How will it change treatment pathways? Why do you think AWA/ASTRO removed the experimental tag from HIFU procedures? The Martini Clinic is the highest volume prostate cancer hospital in the world, routinely doing 2,500 radical prostatectomies a year.
If Therese, one thing the Martini Clinic physicians know is prostate cancer.
Continue to deliver the message that they found HIFU to deliver excellent oncologic and functional results at 7 years post-operatively. As you build your talk track, continue to emphasize the size of the radical prostatectomy program at the Martini Clinic, 2,500 radical prostatectomies a year. They show the initial results of a study retrospectively evaluating patients who underwent a focal 1 procedure in the trailing 7 years.
The found radical-free survival rate of 92% and a continence rate of 100%. Pause and let that sink in for the customer.
The busiest program in the world are telling you that after 7 years, 92% of patients who got HIFU essentially extended their active SURE-LN by 7 years. This is another slide to dig into the customer clinical priorities and how the business/reimbursement side marries the desire to extend active surveillance for prostate cancer. Some probing questions to use during your discussion. What oncologic/functional outcomes do you expect to see from HIFU patients 7 years post-op? What is an accepted timeline for a patient to be free of a radical procedure after focal therapy? How does this compare to other